this number that we're giving you is the number of those individuals who've tested positive for the disease. And early on in this outbreak, those people who had access to testing were only really those who had symptoms, and in certain selected categories, healthcare workers, first responders, other essential employees. If they were symptomatic, they could get a test early on in this outbreak. So these numbers reflect primarily those with moderate to severe to critical disease, not the entire population or prevalence of the disease in our community. So I estimate that, and since we know from the data that 80% of the disease is asymptomatic, mild to moderate, we probably have 5 times that many. So maybe 1,500 folks in Stafford County who have had the disease thus far. Let's see, let's go on. There we go. So this is the trend data for Stafford County showing when the outbreak began early in March and total number of cases to date. And this is the number of positive test results received for the health district, which has a similar pattern. We thought 2 weeks ago this was starting to plateau off at about 15 to 17 new cases a day throughout the health district. That was fairly consistent for a week. And then a week ago, it took off to, we're running about 20 to 30 new cases reported every day in the health district. We think this is probably because of expanded access to testing. So does it mean that the disease is spreading that much more, or does it just mean we're finding more people who have disease? So one of the pieces of data I track more closely, and which is, I think, more reflective and sensitive to the impact of this disease in our community, is the number of new hospitalizations. Somebody who gets severely ill with this disease is going to have access to medical care and frequently may, with severe or critical illness, end up in the hospital. This is a pretty sensitive measure, and you can see it peaked in early April. 4 to 5 new hospitalizations a day. That has dropped off, and I was very hopeful a week ago when I saw 0 to 1 new hospitalization a day. That's now 1 to 2 hospitalizations a day. So you may have noticed what happened a week ago. Did the streets seem a little bit busier to you? People finally getting tired and angry of being held up in home. I think we're seeing the reflection of more people interacting, more opportunities for this virus to transmit from person to person. We're seeing a little bit of rise in the disease now. This is why the governor and his staff and the Virginia Department of Health is being careful tracking this data as we begin to reopen Virginia. We don't want to overwhelm our medical care system, particularly the hospitals. Now, I will tell you, there's not been a hospital in Virginia that's been overwhelmed by this yet. In fact, some hospitals have had to really downsize and stop hiring staff because they stopped providing elective procedures some time ago. So we've got to watch this data, make sure that we don't overwhelm our hospital systems. Finally, COVID-19 is not gone. It's still a person-to-person transmitted disease. So we need to continue to practice these prevention measures that we've been talking about for several weeks now. The value of social distancing, wearing a mask in public, staying home if ill. This is really most important, especially for the elderly, and for folks to stay away if they're sick from the elderly in particular. Elderly and those who have underlying medical conditions. This is, I think, maybe one of our greatest problems right now when we look at outbreaks, whether that be a grocery store or a long-term care center or any place of business, is people feel compelled to go to work. They may not have a guarantee of getting paid if they're not at work. So, and they got this little cough, maybe just my allergies or my cold, so what the heck, I'm going to go to work. Well, guess what? It's those folks who are bringing COVID-19 into the workplace. And so we're continuing to encourage folks to stay home if they're sick, even with these kind of subtle symptoms. Washing hands, using hand sanitizer, great tool. Cleaning contact surfaces, especially if there's movement, people coming in and out. Teleworking if possible, and staying at home, especially if you're in the at-risk population. Those who are elderly and having underlying medical conditions.